This is EMTS Trans Medical Transcription, and this is Eileen Turkell. We're going to briefly review and expound on some of the things we talked about in the earlier movie. Okay, first of all, before we even get into this, about the accident report, sometimes after the accident report, the patient may have gone to the hospital. If that's the case, then we will have to type in certain things. Maybe they took x-rays at the hospital. They could have given the patient medication at the hospital in addition to a prescription to fill in a pharmacy, and those things would have to be filled in. Those would be a different type of a report, more inclusive. Okay, and also another thing, when we type up the past medical history, there might be other things on there, such as the patient had surgery, if he's taking medication, allergies to certain things. It could be a previous fracture, previous diagnosis, like for example, for high blood pressure, things like that, high cholesterol, diabetes, things like that. Okay, that's all I want to say about that. Now, we're going to talk about the muscle testing. Now, if it's the case as is on the screen, then you would type in the following. Okay, let's go down to the muscle testing. Okay, that's the neurological exam, would be the muscle testing and the dermatomes. You would type in evaluation of the dermatomes utilizing a pinwheel was normal, period. Then under the deep tendon reflexes were normal, 2 of the biceps, triceps, bilaterally, and brachioradialis. Now, sometimes they will tell you which one. If not, you just put deep tendon reflexes were normal of the upper and lower extremities, well, you would put 1. Let's start this again with the deep tendon reflexes. Deep tendon reflexes were normal, 2, period. Not period. At the upper and lower extremities, equal and symmetrical bilaterally. One more time. Deep tendon reflexes were normal, at the upper and lower extremities, equal and symmetrical bilaterally, period. Okay, so that's the dermatomes and the reflexes. Now the muscle testing. Okay, we have a chart here. All muscles tested were WNL, which means within normal limits, 5/5, and if there were any that weren't normal, then it would indicate it on that other page, and we would put in except as noted, like let's say it was for the shoulder, so we would put deltoids, would put right dash /5. But if everything is normal, we would just put all muscles tested were WNL 5/5 : and then we have to put this other chart in there. I call it a chart, it's not really a chart. It's grade explanations : and then the next line, it has 5 dash normal dash complete range of motion against gravity with full resistance period, and then 4 on the next line, 4 dash good dash complete range of motion against gravity with some resistance period, and then the next line, 3 dash fair dash complete range of motion against gravity period, and then the next line, 2 dash poor dash complete range of motion against gravity eliminated period, and then the next line is 1 dash trace dash evidence of slight contractility, no joint motion, and the last line is 0 dash and the word 0, no dash no evidence of contractility period.
Can you increase the zoom on that page slightly?
Okay, that covers all of the muscle testing, deep tendon reflexes, and the dermatomes. Now we'll go on to this page, which is the top of the recommendation page, which we don't do anything with. This is the doctor that did the treatment, but we don't do anything. We don't type anything in about it. Okay, this is the bottom of that page. That's what we have to look at. Okay, I'm looking for that bottom of that page. It's probably at the end here someplace.
I think that's the only shot I have at the bottom of the page.
Okay, here it is. Now, here it is. At the bottom where it says patient's instructions. So, this is what we would put in there. You see, all these other things, whatever treatment the doctor gave is already part of the template. You just have to kind of fill in the patient's name, and that's it. And in this case, I guess there wasn't any recommendations, and sometimes there aren't. Sometimes there are no recommendations. But in this case, there was. And so, in the template, it has in there recommendations. anyways, you would put under recommendations, and I believe it's in bold and underline, all caps, and you would put a dash, and then you would put in terms of neck pain, comma, avoid making any sudden movements at the level of the neck, period. And that is it. And then at the bottom, where it has the doctor's name, signature, the only doctor we ever put in there is Dr. period Iris, and her last name is Koch dash DEJESUS. That's her name. You never put anybody else's name in there. That's the only doctor she wants her name on there. Doesn't matter who examined the patient, you put her name there. And in the template it says licensed chiropractic physician, all caps, comma, and under there state of Florida, all caps, and then in subscript dictated but not read. That's how she wants it, exactly like that. Okay. Now we'll go over other things that were not covered in the other movie. Okay, let's see what pages we could look at now. Okay, over here in the this is in the inspection and palpation. Let's see. Okay, after the health and after the chief complaints, okay, over here, visual / digital inspection and palpation of the spine and soft tissues, colon. You would put there is, unless if the doctor puts that there is spasm, just like in this case, you would put 2 pluses means moderate. So you would put there is moderate spasm, and mild, 1 plus, it means mild tenderness at the cervical region of C1-C7. That's all inclusive. Then you would put there is moderate spasm and mild tenderness at the thoracic region of T3-T7. That's what you would put on that particular page. Now, today we're going to also cover range of motion. That's what we're going to do. Okay, in this case, you'll have the template in front of you, so it'll have range of motion, bold and all caps, colon, spinal range of motion, or ROM, colon, and then it will say cervical. and then it'll have flexion, extension, or right rotation, left rotation, and then you will put in there, when it has an arrow going down, that means decreased, and you will put decreased with patient guarding with pain. That's it. That's what you would put, and you have to put it separate for each. For flexion, extension, right rotation, left rotation, right lateral flexion, and left lateral flexion. And in this case, there's no lumbar, so you would just delete that part of the template of the document you're working on. Like, for example, here they have it, but in that case, you wouldn't have it. Alright, now, sometimes there's a shoulder injury. It might be left shoulder, right shoulder, and you would simply say extremity, range of motion, all underlined, colon, range of motion of the left shoulder is decreased, and it would tell you on the report on forward flexion, and back extension and abduction, whatever it is. And also, if it has the thoracic lower trunk that's decreased, then you would put that too with pain, or if there's no pain, then you don't put it at all. Okay, now, another area. Okay, let's see. Well, this is the radiology. This is the X-ray report. Okay, on here, okay, you would put, if it's the cervical, you would put cervical spine. You would put first, all caps, first this is part of the template, radiographic studies. It's already in there. And this is in there too. You just have to change the date. And you put cervical spine, views taken, A-P, and for lateral you put capital L, small a, and small t. That's how the doctor wants it. And then you go through it. And in this case, no obvious gross fracture or gross osseous pathology noted, just like in the template that's in there. It's all in there. And then whatever there is under there, okay, like this says, so you put a dash. The second thing, moderately decreased lordotic curve. And then the one underneath, the next one is going to be right translation. That's the end of the cervical. Then there's thoracic, and in this case you don't have to put no obvious gross fracture or gross osseous pathology noted. This case, they're decreased kyphotic curve. And the next one, now over here it has mild, so you put the first word is going to be mild. Mild levoscoliosis of the apex at T7-T8. Yeah, that's just a repeat of that. Then there was no lumbar spine, so that was just scratched off, so we don't do anything with the lumbar spine. Now, if there was an extremity, like a left shoulder, it would indicate it on that part. Okay. Now over here, it's ROF. We don't have anything to do with it. That's the doctor that filled this out, that did the exam. ROF is review of file, and that was her name and that date. This one is the diagnosis page, and the doctor circles all the things for the diagnosis, and we have to complete it with, in the template it has diagnosis, colon, and then you just have to put the number, and the number is always circled, like I'll show you here, 723.3, and then you would put cervico-brachial syndrome, and then the next line you would hit enter, and the next line, so they'll keep it all aligned in there, you would put 723.5 cervical radiculopathy. And the next one would be the thoracic, and you would just put 724.1 thoracic pain. And that would be the end of the diagnosis. Sometimes it's a knee, an ankle, shoulder. Everyone's going to be a little different. And the recommendations, we already went over that. I think
So this is specific for the EMTS
this is just specific for this company.
Okay, might as well click off the movie, Eileen. Mute. Hit the square. On the bottom, the big square.